Welcome back to the Pause It podcast. I'm Dr. Sam, and with me, as always, is the awesome Dr. Robert.
Welcome back, everyone.
We're really, really excited because it's not just me and Dr. Robert today. We have a visitor that we are so excited. Really, really cool product. So we have the CEO and founder of Fetch DX, and this is Ed Goluch. Welcome. We're so happy to have you on the podcast.
Hi guys, thanks for having me. I'm really looking forward to chatting with you guys.
Yeah, it's a really, really interesting thing that you're doing. And so what we like to do is really give you the opportunity to go ahead and tell us who you are, all about yourself, kind of how you came to, get going with Fetch DX, and then maybe just explain a little bit what it is, if you don't mind.
Sure. Yeah, I could spend like a whole hour just talking about myself. I'll try to make an abridged version. But I come from an academic background, so I have a PhD in bioengineering, and before founding the company, I was a professor, and so I was teaching and talking for a living.
That's very cool.
Yeah, and so yeah, I'm the founder and CEO, and the actual legal name of the company is QSM Diagnostics, and we make the Fetch DX home kits, and so that's the brands that people are familiar with, and so I'll give you a little bit of background because we don't just make the Fetch DX testing kits. We also make tests and instruments that go into the veterinarian's clinic, and that's what we started with. So about 12 years ago, I started to become really interested in a new way to detect bacteria, and that's where the whole concept started. So I was a professor, I had a research group, and we wanted to study how bacteria communicate or talk to each other. And they use chemicals to do this. And so we figured out a way to measure those chemicals, found out that they're really unique for each bacterial species. And so if we detect a particular chemical, we know what's present in a sample. If it's an ear swab or urine sample or wound swab, we can detect it using a new type of technology. And worked on that in the research lab for a number of years. And in 2017, decided that it was time for me to start working full-time at the company and really turn this into a product.
That's
and we
really
launched,
interesting.
Yeah. So we launched the product, which is called the Otter, for veterinarians last year. And one of the things we learned pretty quickly is how busy you guys are. It's
COVID was a rough couple of years.
Yeah.
Yeah.
And so yeah, it's crazy. You guys don't even have time for a free lunch. Like we're happy to go and buy you a lunch, and you're so busy. And when we noticed that, it's the idea came to our team that we should try to help the vet clinics and free up their time. And we already had a state-of-the-art lab and a bunch of experts in microbiology and analytical testing, and so that's where the idea came from, Fetch DX. And so we started selling that at the start of this year, partly to help veterinarians free up their time, but also to make the lives of pet owners and animals better.
Oh, wow. I love that. And it really aligns with kind of what our whole point of what we're doing is like, we got to make this, there's a way that we have the knowledge and the things that we do, and we can help pet owners. And like, that's really our entire goal. So I think that that's really wonderful. I think that's great. Do you find that you're going straight to veterinarians, or are you going more so straight to the client? I mean, how are you generally seeing that your product is actually kind of getting used?
Yeah, so we did market testing when we first started out, and one of the things we found is that the average pet owner doesn't know much about what types of tests they should be running or how much they might cost. And so they rely on the veterinarian to make that recommendation. And so we primarily sell to the veterinary community. So to clinics, to distributors, and have the veterinarians learn about our product, use our product, and then we want them to recommend it to pet owners. And that way, if somebody gets a test and runs it and shows up at the veterinarian's office, they know what they're getting. They know exactly what the test results are and the quality of the test that we provide and how it's going to get used.
And do you ever find any pushback there? Like if somebody has come to you straight to you and said, hey, I think my dog has a UTI and hasn't been to the vet yet, and you send a urine collection kit, they get the results, and then they have to take it to a veterinarian, would be my guess. Is that right?
Well, yeah, if they have a UTI, they're going to have to talk to their veterinarian.
Right.
And that's, I think, this a whole new category of products that's coming out of these sorts of kits. It's been around for a few years for humans, and you can do tests on your own at home and show up at the doctor's office. And I think it's similar. If they haven't come across it before, they're a little bit nervous. Like, what is this? So that's partly why we want to educate veterinarians as much as we do pet owners. But for the veterinary community, I really see this as a benefit. So now somebody's already done some of the testing, so you don't have to. And you can potentially process them if you already have a relationship and have seen that pet before, get them the medication and get them on the road. And so you can help other pets that have more serious problems. And I think that's kind of the goal with all of our tests, is to help relieve some of that workload. So and to educate the pet owners so that they're not waiting too long. So I would say if you run the test as soon as you see signs of an issue, you're going to get a better outcome instead of waiting and then having to go to an urgent care or an ER because you've waited too long, and then your veterinarian doesn't have time for an appointment. So we try to bridge that gap and try to ensure as much as possible that both sides are happy with what the results are.
And generally, how quickly? Oh, sorry, Robert. I was just
no. I think you had the same question that I had actually. The turnaround time for the test.
Exactly
I think was
yeah. There you go. Right. How quickly do you get your information?
So if they're buying from our website, they can choose either 2-day shipping or next day shipping to receive the kit. And then all the kits come with 2-day return shipping. So we'll get them back within 2 days. It's air shipped, and we get all of the initial test results within 24 hours. So from collecting the sample to test result is less than 72 hours for things like urinalysis or cytologies or fecal samples. One of the things we're really trying to get across to pet owners is that particularly if their pets have issues, like they're prone to UTIs or ear infections, you should have a kit at home. They're good for, the ear kits are good for a year, the urine kits are good for 3 years. So having them at home and grabbing it off the shelf as soon as you start to see issues gets that process started even sooner.
And can I ask a quick question? Just because I'll say right now, I mean, like looking at the packaging that you were nice enough to send me, so I could kind of take a look at it and really kind of dig in a little bit. I'm curious because I have the ear kit right here. So these look like culturette. So are these for culturing an ear specifically?
Well, so we use them for all of our tests. So that's why we give you 2, and it's only for 1 ear because we run a couple different tests on it. So we do the cytology, which is when we get that swab, we put it onto a microscope and stain it. And we actually take pictures, and we'll send those pictures to the veterinarian to confirm, so they know exactly what it is along with the report. And the pet owner, when they get the kit, they register it, they can log in and they'll be able to see the test results as well. So they have a little portal and they see all the test results. So they'll see the cytology results. And then with the second swab, we run a couple additional tests. So one of the tests we run on that ear swab is actually using our technology. So we can test for the Pseudomonas bacteria that's
Right.
really problematic in ears.
Right.
Yeah.
And
When you were first
yeah.
talking about that entire thing with the bacteria, I mean, literally my head went to, oh, resistant ear infections in ears. I wonder if that's why you've given me this kid. So
Exactly. That's why we
it's
started
really
with ears.
interesting.
Yeah.
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 I mean, I'll tell you, there's a lot of dogs that would be very thankful to
Oh
you
yeah.
if you could figure out what's growing
Yeah.
in those ears, because they can be really, really difficult.
Yeah. Yeah. And if you have kind of chronic issues or have tried a few different meds and it didn't work, uh, we have a couple versions of the kit. So we have one that also includes a full culture ID and sensitivity.
Right.
So that way your veterinarian will have all of the information, and that test takes a couple days longer. And so if you can get those results before the visit, they'll have a lot more insights into what to prescribe for a medication for you. And particularly if there's resistance, they'll keep that in mind. And so that's really the gold standard. You'd want to do that every time. We know that that's not something that is afforded every time, but when you can, or if it's a systemic issue, you want to run that. But if it's a first time issue, you can get the standard cytology and QSM kit. And that already will give the veterinarian a lot of results, and they'll be able to treat more effectively.
Yeah.
And I can say from my side of things, one of the reasons I actually really enjoyed talking to Ed, we met at a conference previously. I work with, quite a few dermatologists and internal medicine specialists, and half their patients are those chronic cases where they have those chronic ear infections due to allergies, or they have UTIs because of their kidney disease or diabetes. And just to have that test ahead of time where they don't actually have to waste 30, 45 minutes coming in for an appointment just to get a sample, they can submit it ahead of time, and then they'll have that relationship already established with their internist or dermatologist. Is really such a great thing to save, as you mentioned earlier, like saving time. We're all so short on it right now, but to be able to save some of that time, to have that information ahead of time is huge. So I love what you guys are doing. I think it's such a cool thing.
Yeah.
So I'm glad you were able to join us today for sharing that about with everybody.
And I think too, what I've seen a lot of lately, just given where I am, so I'm in the northern part of Indiana, and we don't have any dermatologists specifically, as made me think of this, except maybe in Chicago or Indy, or so everyone's 3 hours away or 2.5 hours away. And we do have those cases where we'll send them down to the dermatologist, that we've been working with them, we've been dealing with things, and we're like, we need that extra little bit of expertise. Well, now there's sometimes where they'll then do a follow-up telehealth visit or something like that, whereas if they didn't have to drive 3 hours, but they could have gotten that ear cytology or something like that, and done it that way. I mean, that's a really nice kind of synergistic way to do that, where they're still getting to have that expertise, but they don't have to make a 3-hour drive to get there.
Yeah, it's a time saver for the pet owners as well, and trying to schedule a visit, and if you have to take time off from work, this opens up a lot of flexibility for pet owners as well as the veterinarians and the specialists. And I think that's similar on the urine kits that we have for cats and dogs. Like if it's part of a wellness test, you don't want to do a cysto and poke the cat or dog unnecessarily, but you also don't want to sit around and wait for a urine sample. And so if you can have the pet owner collect it at home on their time, and send it in, and just check on the test results, that'll really help get those tests done much more frequently and get them into the medical records.
And I have to say, I think a lot of cat owners would be really freaked out by the idea of somebody ever telling them that they had to collect a urine sample. But I really feel like you've made it like really easy. This is quite a comprehensive kit that you've put together here.
Well, so I have 4 cats myself, and
that makes sense that you understand this.
yeah, so a lot of real life R&D went into this, and
you even included more than one substrate.
Yep.
So
cats get really picky, and So
Very
we
true.
include 2 different types of litters.
Yeah.
So you can
Here they
figure
are.
out on the first kit which type your cat likes.
Mhm.
And so one of them, that one is our own proprietary blend, actually.
Oh,
Oh,
wow.
nice.
Yeah, that we tested out. We bought everything we could find on the market, because a lot of times the only thing that the veterinarian has are what they call the nose orb, which are kind of the plastic beads.
Yeah,
And the cats hate those. They don't feel like
it's true.
litter, and they don't want to use it. And so we did the research. And the other one is the Kit for Cat hydrophobic sand, which is a popular product.
Yeah, I
Mhm.
think it looks kind of like this. Is that not what this is?
It is.
Oh, okay. Yeah,
Yes.
because I was gonna say this
Yes.
is what we have, but I've
Yep.
used the nose orb and I agree with you. No cat likes it.
Yeah, nobody uses the nose orb, but the Kit for Cat is a good product.
Hmm.
But some cats still don't like it because it's sand. It doesn't quite feel like normal litter.
Yeah.
And that's why we have the other one. It's actually a non-absorbent, biodegradable plastic litter.
Oh, wow.
And so uh, it comes clean, and we provide the liner so that and an eyedropper. So you're using that one. You just pick
That's
up
true.
a couple drops of urine
Yeah.
from the clean liner, and ship it back to us in a nice small package
Yeah.
and get the results in a couple days.
Yeah, I mean, it's really great because that is such a barrier for some cats that get really, really stressed coming
Mm.
into
Yeah.
the clinic. And then we're doing so many more of like the freestyle Libras for our diabetic cats and stuff like that.
Yeah.
So to be able to have something that we can really easily go ahead and check a urine without then stressing them out at the clinic, and that is a really nice way to do that. And I really love this kit for the cats because I think people are so afraid of having to
Yeah.
collect a urine in a cat, and you've really made it like really, really user friendly. Um,
Yeah.
so I think that's really
And the
nice.
cats get so stressed getting dragged to the vet and back.
Yeah.
Yes, they do.
And so you could potentially even get a little bit more accurate test results if you collect it at home.
At home. Yeah, I definitely agree with you. Do you ever get any pushback though from the practices that might feel a loss of revenue if they're not the ones running the tests, or what's been kind of the objection there or the challenge for you?
Well, so it's interesting, but we have a great short answer is, if your cat's in this position, you should reach out to your veterinarian
Mm-hmm.
and ask them, because the veterinary clinics can enroll with us, with our company,
Great.
and we actually do revenue sharing. So they'll receive part of the profits from the test back if they're enrolled. So if
Awesome.
one of their pet owner clients goes to our website and says, "Oh, this is my clinic," they're already enrolled. That veterinary clinic can set its own pricing for the products, and they'll get an automatic rebate for every kit that one of their clients purchases. So they're not out of the loop
That's
that
really
way.
nice.
Yeah, and we also offer the option that the vet clinics can buy the kits from us and have them in the clinic. So if they prefer that, and the pet owner can come in and get it from them directly. But it's interesting. The bigger pushback is actually with the big reference labs. Oftentimes, veterinary practices are locked into long-term contracts, and they have to send so many samples to the lab because some of these tests they can't run in-house.
Yeah.
And so what we try to tell uh, the veterinarians is the, this isn't a huge number of tests. Like, most of the tests you're sending in is blood work. We don't do blood work. Um, Urine samples aren't getting sent in that frequently. And odds are you're going to be running more tests because we know how frequently these things don't get done. So you
Right.
can send a kit home for a follow-up visit with the medication, as well as having the front end check. And overall, you're not going to lose out on your quotas or requirements. You're actually going to run more tests in the long run.
That's a really interesting way to think about it. And it's good. I mean, I think whenever you have a different idea, whenever you want to kind of shift a paradigm a little bit of like, it's okay to do this and that. You know, you're not saying
Yeah.
this or that. You're saying there's
Yeah.
plenty of tests and plenty of animals, and we can all help each other. And
Yeah,
I think
there's
that that's a
plenty
good way
to,
to do
yeah,
it.
yeah, there's plenty to go around, and none of the reference labs offer mail-in tests for urine or ear samples. So they only accept samples from the veterinary clinic. So uh, it, I don't even see that as a competition. It's
Right.
a whole
Yeah.
different category.
Yeah, you're
Yeah.
offering a convenience to the pet owner, which is, I think, a huge thing, and even to the veterinarian. Again, saving that time is huge for both parties, especially in particular situations. So I think that's very cool. Do you guys see any pushback just from veterinarians in terms of getting a cystocentesis, where obviously you're poking the bladder, versus just those samples that are coming, like in terms of sterility? How accurate is the test in terms of you're going to culture it afterwards? Any information on that side of things?
Yeah, so I think most of that is educating both the pet owner and the veterinarian more about microbiology. And I think there's a lot of myths and misconceptions around handling urine. So we get questions about this pretty frequently, and it's funny because we get them on both ends of the spectrum. So there's lots of studies that have looked at the stability, the chemical stability of urine. So we know that the pH, specific gravity, and a lot of the chemical analysis you do does not change, even with being stored at room temperature for 48 or 72 hours.
Nice.
And uh, that's not widely known because uh, just kind of historically, you think of it, you need to have a fresh sample and you need to refrigerate it right away. But uh, that was done before people had done a lot of studies, and it just kind of has perpetuated. Where it's where it comes up more frequently. Oh, and for the veterinarians, one of the other big things is crystals.
Yeah.
Um,
I was
and
just gonna
actually,
say that.
yeah, the newest data actually shows that crystals are more stable at room temperature, and that
Yeah.
you have issues when you change the temperature because the urine comes out warm from the
Mm-hmm.
animal, and
Mm-hmm.
if you put it into the refrigerator, that's when you have more issues
Mm-hmm.
than actually just leaving it at room temperature. You might increase the amount, but they're never going to disappear. So if anything, you'll notice small issues a little bit sooner and potentially catch them faster. You're not going to spontaneously form crystals if they're not there to begin with. Um, but then the other part where the cysto normally comes in is if you are going to do a culture and you're going to send this in and you want to know exactly what bacteria are there and how many. And there as well, well, I guess the first analogy, not coming from the veterinary world, but more from the human side, how often do you run a cysto on a human? You
Can I
collect a
just say that?
pre-catch
Didn't I just
sample.
say this to you the other day, Robert?
No,
I
100%.
love you. I
No,
literally just said this to him.
no.
I was like, why is this insistence that you have to poke a
Yeah,
bladder to get a culture and sensitivity? Sorry, I
yeah,
don't mean to bear, like, I
yeah.
was just getting very
Well,
excited.
so it also comes in with understanding the test results and
Mhm.
what kind of test is getting done exactly. So we do a quantitative uh, culture, and so uh, you it's true you're going to get some contamination. It's never completely clean, but it's going to be a relatively small amount. And so if you're doing a quantitative, you have cutoffs. So if there's a little bit of contamination, it's less than 100,000 colony forming units per ml,
Mhm.
or they have different metrics as well. But if it's a low number, you can usually rule that out. And you'll
Mhm.
also see, like, if there's no elevated white blood cell counts and things like that, that, hey, it's probably not an infection. But then the other piece of information that's valuable is once you actually know what the bacterial species is and its resistance profile, like oftentimes when we do see contamination, it's with natural flora. So it'll be some really obscure bacteria that never causes an infection. So if you look it up in the microbiology textbooks, like, oh, it's found on like grass or certain flowers or something, and it's not non-pathogenic. And so if you were just looking and counting colonies but not identifying, you could have issues. But if you actually know what the species is, and then, hey, it's susceptible to every antibiotic, you can really make better decisions that way and say, oh, this is just some contamination I don't need to worry about.
Yeah. I mean, I've definitely had the experience myself where I more than one time had a patient that for whatever reason we had to do the culture off of a free catch.
Oh, yeah.
And I've had people be like, well, you can't, how can, and I'm like, yes, you can. I can look at the species. I can see how much there is. I know what is the problem and what is not. And I'm not worried about it. And
and
that makes me feel a lot better.
And we've actually tested some really dirty samples on purpose. So we'll put urine down as part of our testing process onto the floor and pick it back up and run cultures on it to see what comes back. And very rarely does it come back with anything. And that's
clean floors. It's good.
Clean floors, but also urine isn't a very nutritious media. Like, so even if the bacteria do get in there, they don't have a lot of nutrients to grow very quickly and multiply to the levels of an infection. And so,
unless maybe they're diabetic and there's a whole bunch of sugar in that.
A whole bunch of sugar.
No diabetes. That's
even
really cool,
then, you'll have a ton more of the other bacteria that's already causing the infection there. And hopefully
that's really fascinating.
So coming into this world from kind of the engineering and microbiology point of view, it's really interesting to see, and kind of fun to, well, it kind of brings back my teaching hat of saying, well, let's think about this. Why are we doing these things this way? And can we bring some more information to the community?
Yeah, and I think we're always learning, right? I mean, and that's the thing. And a lot of times, I don't know if this really makes sense for what we're talking about here, but like a lot of the studies and things that we do in veterinary medicine are just so small, you know what I mean? And so, it's interesting that you're coming at it just from a totally different vantage point, but just like a very, very knowledgeable, and you know your subject very clearly. And so I think some of those like things that these rules that we make, like you have to do it this way, and it's based on this like tiny little sample size that we've all just, that's how we got to do it.
Just historical stuff that we've always done. So it's like that ingrained in stone type thought, and it takes a while for the new information to come in and be like, oh, this actually has evidence supporting it as well.
But that's how we all want to practice medicine, right? So that's good.
Exactly. Well, is there any new exciting things coming up with you guys that you want to share with our listeners that you guys are looking forward to coming up?
So definitely one of the things for 2023 that we're really going to be highlighting are wellness kits and bundles. So for the listeners who don't bring in their cat or dog for their annual checkup, or find it challenging for any number of reasons, they can buy one of our kits and get at least a fair amount of that health data and routine testing done. So we're really going to be highlighting that and rolling out some new products for those types of tests in the new year. We also have some really cool partnerships that I can't get into the details about, but
of course,
at a high level, I'll say it's really interesting in the world of kind of wearable technology. I'm sure you guys are seeing more and more things of like smart dog collars or smart litter boxes, or feeding bowls.
Feeding bowls,
And they give you all this data, and probably the last thing as a veterinarian is you want to get phone calls or emails every day, every time a notification goes off.
That's an understatement, yes.
So if there was a way to tie in our tests and actually see if there's a real problem and coordinate those things, I think that's really potentially the future of kind of diagnostic testing and wearable technologies for pets.
Yeah, I think that's great. And then do you have a website where people can come and like take a look? I mean, these kits are really awesome, and I know you have your pricing right there, so there's no mystery. It's like this is how much it is, and people can take a look at it. So what's your, if you want to give everybody your address?
Sure. So for the pet owners, they should go to fetchdx.com. And the DX is a common abbreviation in the industry for diagnostics, in case people don't know. So it's fetch, like throwing the ball, and dx.com for that. And for the veterinarians that they want to learn more about the science and the studies that we do, they can go to qsmdiagnostics.com and learn about kind of all the other things that the average pet owner probably doesn't want to get into, but would be useful for the vet practice.
Yeah, those of us who like to sit there and get into all the nitty gritty. So that's great. That's wonderful.
Awesome. Well, I think any other questions from you, Sam?
No, not necessarily. I'm really excited about what you're doing. I think it's really cool. And I know that also too on myBalto there's links to FetchDX too. So I didn't know if we were gonna necessarily say how maybe those two things can kind of work together as well.
Yeah, definitely. That's one of the things. That's one of the reasons we started talking in the beginning with Ed. Hopefully give another avenue for them to get some exposure through our clients on myBalto. So you can also go to myBalto and purchase those tests through there, and then get the results for FetchDX, which would be awesome. So we encourage everybody to go check those out, and we'll have some articles from FetchDX too, to when to use them. They'll be coming soon. So hopefully you guys will all enjoy it. And you guys always send us questions too through our email at podcast@mybalto.com. And we're happy to answer those regarding this podcast or other questions that pop up in the meantime.
Yeah, and I mean, this is really, really interesting, and I really am excited to kind of share this. And so we'll have lots of information, and maybe even try to kind of highlight some of the kits and stuff that you have when this podcast comes out, so that people can really kind of dig into what you do, because I think it's really exciting. And so there'll be some good content and stuff like that around it. So I really can't thank you enough for coming. I mean, this was super fun, and I really love to hear what you had to say.
Yeah. Well, thanks for having me. I've had a lot of fun chatting with you guys.
Well, thank you so much. Thanks. So this has been the Posit Podcast. And once again, we've had Ed from FetchDX, and you should check that out for sure. And we really, really appreciate everyone coming by.
Bye, guys.